So, Lofton, what is harm reduction to you?
This is a great question, and there are lots of answers to it. So on one level, harm reduction is anything that decreases the negative consequences of drug use. And harm reduction is, as sort of a model of approaching risk, is something that we use a lot in other aspects of our lives without thinking about it. So for example, driving is really dangerous. We know that driving a car is, one of the more dangerous things we're likely to do in our lives, and it's pretty likely at some point that we'll hurt ourselves or hurt somebody else while we're driving a car. But as a society, we don't respond to that by saying nobody can ever drive, nobody can ever build cars. All car-related activity going to result in, stigma and criminalization. Instead, we say, well, what are the things we can put in place to make what is inherently an unsafe activity as safe as possible? So things like airbags, seatbelts, speed limits, driver's licenses, changing sort of social norms around things like texting and driving. Those are all things that help make driving as safe as possible. So harm reduction is really just taking that same practical, non-judgmental approach to risk and applying it to drug use or to other activities that are criminalized or stigmatized, like sex work. So it's helping people reduce the risk of death by overdose, reduce the risk of illness from things like bacterial infections or viral infections, helping people improve their health and their well-being while they're using drugs. And so harm reduction is also, as a philosophy, it's about acceptance and non-judgmental behavior. So it's about accepting that people have the autonomy to do what they want with their bodies. We're not going to make people's choices for them, and that everybody has dignity and worth as a human being. So offering unconditional support and positive regard to people and helping them improve their health and well-being, whatever that looks like for them on that day.
How do you define harm reduction?
Favorite question. I define harm reduction as anything pertaining to being safe. Safe use of drugs, sex, seat belts, anything that can keep you living longer and keep you safe, that's harm reduction.
And what are some examples of harm reduction services?
So there's tons of different ones. Naloxone distribution programs that make sure that anybody who's at risk of experiencing or witnessing an opioid overdose has naloxone on hand. That's an important harm reduction program. Syringe services programs, which provide sterile injection equipment and other supplies for people who are using drugs to help them reduce their risk of bacterial or viral infections. Those are examples of harm reduction programs. There are also things like safe consumption sites that some places have, which are just safe, healthy spaces for people to use drugs in a way that's monitored by healthcare providers, so that they are there's somebody there to help them if they overdose, and there are people there to connect them to resources and things like that.
What are some harm reduction strategies that you've used?
Harm reduction strategies, or some harm reduction strategies, are things like always using a clean syringe anytime you inject drugs. Another strategy is to track how much you're using, how much money you're spending on what you're using, and to pay attention to those things and try to moderate it. So if you're tracking how much you use and how often and how much money you spend, then you can start to pay attention and think to yourself, I don't want to be spending that much, I don't want to be using that much. And that's one way to help reduce the harms caused by drugs. Other strategies would be always carrying Narcan or never using alone. Harm reduction started in the 1980s during the HIV epidemic. Folks were sharing syringes when they were using heroin intravenously, and when they shared needles, they were sharing HIV. So to help prevent the HIV, folks started giving out clean syringes to people who use drugs, which was sort of a radical idea, but it made a real difference and really started to change the rate of HIV infections. So it was a radical idea, but it was really helping folks. And that's basically what harm reduction is. It's the idea of reducing the negative consequences that drugs can cause in any way. It may not be quitting drugs. It may be using less or using something different. Abstinence isn't the goal, but health and happiness is. I was in a traditional 12-step program for 10 years, and I tried it, but it just wasn't that helpful for me. But eventually I started to find harm reduction based support groups and learn about harm reduction. And it really clicked for me. And I think everyone's different. Some people are going to prefer 12-step programs. Everyone's going to like different things. For me, harm reduction based support groups and something that isn't just abstinence only, I find that much more helpful in my life. I feel that I deal with less shame. And also, the first time I went to a harm reduction based support group, the things people were talking about, it felt like they were saying things that I had always felt but I didn't have the language to express before. It's like all of it made so much sense to me, but I had never heard any ideas like that. Like, have you tried to use safer? Sounded absolutely insane to me, but it made a lot of sense, and it certainly wasn't going to hurt. My life was at a pretty bleak point at that time. I definitely have found some great judgment-free, stigma-free support in harm reduction support groups.
Harm reduction taught me how to moderate. It taught me how to use safer. It empowered me to take control of my health and educate myself on what substances I'm using, because different substances interact with each other differently, and some enhance and some cancel and some you end up overdosing. The support groups that were centered around harm reduction were more useful in my case because I had no desire to quit using. I just wanted to be able to not mess my life up, not lose my job, not have my mom crying, asking what she did, so it really, I took responsibility for my actions.
That speaks to the idea of harm reduction as a spectrum.
Mm-hmm.
Like you were saying, you just didn't want your life to be as chaotic anymore, and harm reduction embraces that idea that some drug use might be functional, some might be beneficial. It can all look different. It's not either or, it's not abstinence or total chaos, which is what I had been taught before. But harm reduction embraces the idea that drug use can happen over the spectrum and people can move up and down that spectrum. I think it kind of makes sense that a drug problem's a problem when it's a problem. And so looking at the problem at hand and seeing are there ways I can reduce this? If I'm not willing to give up drugs, is there a way I can spend less money on drugs? If I don't want to use less, can I use in a safer way? It's always looking for any kind of positive change that you can make.
Right. Utilizing your syringe exchange programs for syringes, regularly getting tested for HIV, Hep C, and educating yourself as far as what substances you're using, testing the substance, trusting not only your source, but trusting the people that you're around, educating yourself on recognizing and reversing an overdose if opiates are your choice.
Harm reduction as a movement, as a social justice movement, recognizes that not everybody is born into similar situations. Lots of people are given different opportunities. Some people are given more privilege than others. Because of this, how destructive a drug can be in your life can be affected by things that are totally out of your control. If you live in a state where weed is illegal, you could be getting in big trouble just for smoking a little weed, where in another state, you wouldn't be getting in any trouble at all. And so often the drug user is framed as the person at fault, but harm reduction looks at it holistically, and it looks at the whole situation and tries to really see all the different factors going on and recognize that it's not just one person making bad decisions. A lot of people think harm reduction might enable people. I think that's a common fear. People think you are enabling a person to use, you're encouraging them to use, or that harm reduction is ignoring how deadly fentanyl is, something like that. Harm reduction recognizes that drugs are very risky, and they can have very negative consequences and they can cause very real harm. Harm reduction confronts that and tries to deal with it. There have been studies that show that, when a syringe exchange program comes into a neighborhood, drug use in that community does not increase. And there have even been some studies that show that sometimes drug use decreases when a syringe exchange program becomes a part of the community. And they believe the reason for that is because a syringe exchange program offers support to folks who need it. It offers connection. It offers referrals to services and to treatment. And so people are more likely to get into treatment if they are a member of a syringe exchange program. Harm reduction is very data-driven. There's a lot of science behind harm reduction that shows that it works. So, it's not a crazy idea. There's a lot of studies behind it supporting that it is that it really does improve outcomes in people's lives. It does things like reduce overdose death rates, increase positive outcomes in recovery, things like that. At the end of the day, what is really so wrong about saying that I don't think people should learn a lesson by putting their life at risk? I don't think HIV should be a learning experience to teach people they hit rock bottom and they should sober up. Or, if somebody, nowadays so often people end up overdosing before they could ever hit rock bottom, or whatever rock bottom is. It happens so soon and so quickly, and nobody can recover when they're dead. Harm reduction is basically the idea that you want to reduce the negative consequences that drugs cause. It embraces the idea that drug use happens on a spectrum. Abstinence is not the only path to recovery. There are a lot of ways people practice harm reduction all the time in their life. Seatbelts, fire extinguishers, condoms are all forms of harm reduction. It's just when it comes to reducing the harms of drugs that can be very stigmatized.